All right, we're going to get started. So good evening, everyone, and thanks for joining and taking the time out of your evening. I'm sorry that we unfortunately cannot do this in person. Looking forward to doing that soon, but thank you for your time, and hopefully this will be informative. Also, just wanted to say thank you to MEDTRONIC for co-sponsoring this with Georgia Urology. So just as a matter of introduction, my name is Dr. Shapiro. I've been at Georgia Urology now for 6 years. Before that, I did my training at Columbia University in New York City. And I practice general urology, but one of my special interests is in helping both men and women with bladder symptoms and giving them options to help fix those. So many of you may be identifying with some of the things that are now coming up on the screen. Will I have control? When we can go outdoors, can I go to an outdoor celebration? Can I leave home? And I think more important than just saying, are these things issues that concern you, is saying, maybe you'd be potentially too embarrassed to talk about that. And this is a big issue because unfortunately, 44%, so almost half of people say they're embarrassed to talk about these issues. And the theme of tonight's talk is to try to change that. Make this something that is on your mind, and if it bothers you and you want something done, to know that there are options out there for you. So this is called Live Without Limits. And here's what we're going to be talking about. This is sort of the agenda for tonight. We're first going to be talking about bladder function, what's normal, what's abnormal, what happens, what's supposed to happen, and what can go wrong. We're going to then focus on some of the treatment options that are available for overactive bladder. We are then going to talk about specifically third-line options, which we'll get into, which you may or may not yet be aware of. And finally, we'll wrap it up by answering questions. Just as a matter of housekeeping, all of the participants have been intentionally muted, but there is a question box that's available on your Zoom, and you can certainly type in the questions, and at the end, we'll get to them and try to answer as many as possible. So let's start. The most important thing to know is you are not alone. I think that's important to say. 1 in 6 adults may have overactive bladder symptoms. Putting that into context, that's more than people who have vision problems. In fact, it's more than people who have diabetes. And just like those, this is not an issue just with women. Oftentimes people think of it as being an issue with age and with women, but it can affect both men and women of all ages. It is true that with age, with increasing age, it's more likely, but it can be really in any decade of life. And the problem is, if you ignore these symptoms, it can often lead to a deleterious and a negative effect on your life, whether that comes in the form of losing sleep, whether it limits your social calendar, whether you're afraid to go certain places or leave the home at all. And it can just lead to a very poor self-identification, poor image. And as I mentioned in the first slide, it's an embarrassing thing, and unfortunately, it doesn't always get brought up. So I want to also say that it's not normal to leak, although it may be more common, although it may be something that you have had to deal with or know people who have had to deal with this. This is not to be considered a normal part of aging. Some of these things will probably sound familiar. Going frequently, having that, gotta go now. We call that urinary urgency. You feel something suddenly when you stand up, you get out of the car and you just have to go to the bathroom immediately. You have to do what's called bathroom mapping. You go somewhere and the first thing you think about is not, am I gonna enjoy this experience, but where's the closest bathroom? How am I gonna get there if I need to avoid an accident? It may limit what you can drink, and unfortunately, you may need to have pads. And the bottom line is this is an embarrassing condition, but it doesn't have to be. And if these things are symptoms or sound familiar to you, your body is trying to tell you something, and I think we need to listen to it. So let's go back to the basics and talk about the bladder, how it works, and what's important here. So we'll start with this middle part of the slide, which is the kidneys, which on the screen are those two organs that you see in the middle. And the kidneys filter the blood. They filter the blood and produce urine. The urine goes down two tubes that are called the ureters into the bladder. And as the bladder starts to fill, there will be a sensation of that your brain detects, which is that you may need to go. Now, typically, as it fills, you may have that sensation, but you're able to say, well, this is not where or when I want to go, and I'm going to suppress that urge, and I'm going to wait till it's a better time. But your brain should be getting that signal. And then ultimately, the brain, when you are ready, sends a signal back down to the bladder to do two things. One is to release the part of the continence mechanism, the sphincter that's there, which is normally holding the bladder back, and also to contract the bladder and squeeze the bladder to evacuate urine. And I think the take-home point from this slide that I want you to leave with is two things. One is that bladder and brain communication, and there's an intricate system of nerves with the spinal cord and the brain. This is essential for bladder control, and that any breakdown in this communication can certainly cause bladder control problems. And as we'll get to a little bit later, it stands to reason that if you could somehow fix this communication breakdown and regulate it, you can also alleviate and help a lot of these symptoms. So what causes bladder control problems, and where does sometimes with communication, where does the problem come from? It could be something as simple as your daily habits, caffeine, alcohol, spicy foods. These can all be triggers. Just like someone who may have digestive issues and they know certain foods are known triggers for reflux or upset stomach, there are also known triggers or what we call bladder irritants. It could be medications. If you have a high blood pressure medication that's a diuretic and it makes you get rid of a lot of fluid, that can certainly exacerbate this. If you have certain diabetes medications, that can also make these symptoms worse. Any other life-changing event, pregnancy, childbirth, an issue with the pelvic floor can certainly exacerbate the symptoms as well. But oftentimes it's nothing you're doing, it's nothing that happened to you. It's just a process of age and with deterioration of some of these normal communications that we just mentioned. So I would say there are, in general, 3 common bladder problems. And we're going to go into each of these in turn, but for the purpose of tonight's talk, we're really going to focus more on overactive bladder with or without what's called urge incontinence, and we'll get into the details, and I'll define exactly what that entails in a few minutes. So stress incontinence, this has nothing to do with overactive bladder. This is where the opening of the bladder, where the pelvic floor muscle normally is able to prevent an accidental leakage of urine with either laughing, coughing, sneezing, jumping, exercise. This is a totally independent issue. Kegel exercises are things that may be a conservative measure to help this, but it may require surgical correction, and this would be an indication for a sling, a urethral sling. Next, we have urinary retention. There are a number of reasons why the bladder may have deteriorated. It could be a medical condition like diabetes. It may be from patterns of holding urine too long and overstretching the bladder. And oftentimes the symptoms here are you can't always tell when the bladder is full. You may not get a strong stream. You may feel like you have to push to empty. And even when you feel you're empty, you may not be. And if it gets to the point where you really cannot empty the majority of the volume in the bladder, you may need a catheter, either that stays in or that goes in and out. But again, the focus tonight is going to be overactive bladder. And there are sort of two varieties of this that I wanted to just differentiate. The first is urge incontinence, which I mentioned before, and the other one is just urgency and frequency without incontinence. I think it's important to note that overactive bladder doesn't tell us a specific cause or etiology of the symptoms. This is really giving us a set of symptoms, a constellation of symptoms. The hallmark symptoms are urgency, which is that urge to go. You can't postpone or find it difficult to postpone. It includes frequent urination, so going more often than every 2 or 3 hours. It includes nighttime urination, waking up from sleep and having to go to the bathroom. And it may or may not include urge incontinence, which is when you have an urge to go, but you can't make it in time. And unfortunately, before you're able to get to the restroom to empty the bladder the way you want, you may have a leakage. And that can span anywhere from a couple of drops to in the entire evacuation of your bladder. So talking about what are the treatment options, we just mentioned diagnosis, and now if you have it, what are the treatment options? So again, there's a spectrum that is as most conservative, lifestyle changes, oral medications, and then advanced therapies. And just as a way to think about this, this is really first, second, and third line treatment. As I mentioned in the agenda, the third line therapies, this is what we're talking about. These are the advanced therapies, and these are really geared for patients who fail lifestyle changes, fail oral medications, or they just don't want to take a medicine every day of their life or have side effects. So let's go into more detail now of these treatment options. So what are some of the lifestyle changes? This can be something simple like changing the diet. If you can in some way identify that it's caffeine or it's alcohol, you do something as simple as avoiding diary. You just record every day what you eat, when you eat it, and when you go to the bathroom. That may be illustrative to you to figure out what your symptoms are and what's triggering it. And if you can avoid diet, that may be helpful. Biofeedback and pelvic floor muscle therapy are really, I would say, the mainstays of lifestyle changes. And for the right patient who really doesn't want to do anything more invasive and who's dedicated to this, certainly data has shown that this may be as effective without as oral medications. And just to differentiate, I mentioned Kegels before. This is physical therapy that's not actually strengthening the floor, but oftentimes it's relaxation of the pelvic floor muscles that may be involuntarily in a spastic and contracted state. So oral medications, some of the oral medications that have been around, some of these names may sound familiar. You have Ditropan, you have Toviaz, you have Vesicare, you have Cinctura, some of the newer ones, Mirabetriq, Gemtesa is the new one. And these are all, they work different mechanisms, but the idea is they regulate the bladder to have you go hopefully less urgently and less frequently. But just like blood pressure medications, these are medications that you will take the rest of your life. And just like other medications that you may or may not be taking, they can have sometimes unpleasant side effects. The typical side effects from all the medications I mentioned, with the exclusion of Mirabetriq and Gemtesa, is dry mouth, dry eyes, constipation. If you have certain visual issues, glaucoma, certain forms of glaucoma, you can't take the medication. If you have issues with slow emptying of your stomach, you can't take the medication. And what I have here is that close to 3/4 of people stop bladder medications within 6 months. This is important in that compliance with these medications we know is an issue. And if the medications work, that is great. And for those patients who don't mind, that's wonderful. What I really would like for all patients is if the medications don't work, to sort of not just assume this is a set of symptoms that you have to live with the rest of your life, but to know that there are additional therapies that can hopefully help get you dry and help you just sort of live your day-to-day life without the worry of constantly having to go to the bathroom and leaking. So that brings up the advanced therapies. Again, this is for people who either cannot take medications for whatever reasons, don't want to take medications for whatever reason, or who have side effects. And the two categories here is either Botox injection into the bladder, or second category broadly is sacral neuromodulation, which then gets subdivided into INTERSTIM, which is an implantable technique, and we'll obviously go into that. And the other one is an office-based, non-invasive option, which is PTNM, which is posterior tibial nerve modulation. So what are the pros and cons of Botox? Botox is a medication which acts to paralyze muscle fibers, most commonly, obviously, for cosmetic reasons, but it's the same exact drug that people have injected into their bodies. But in this case, we inject it in the office setting without any anesthesia, typically directly into the muscle of the bladder via the use of a telescope. So it's under vision. It goes into multiple areas throughout the bladder wall. And the idea is that you can relax the bladder and you can calm the bladder down and help a lot of the symptoms. Important to know that it's temporary. So usually every 6 to 9 months, it needs to be repeated. There is a small but not insignificant risk. I would say 5 to 7% of people who might need temporarily to catheterize. The way I would think of this is if the Botox works too well and it quiets the bladder too much, you no longer can generate enough force where you're able to empty the bladder. And that's something just to know about. So if you're someone who says, I absolutely under no circumstances want a catheter, or I cannot physically catheterize myself, that's something to know about. There's a risk of infection because we're injecting the bladder, obviously, with the medication. And like I said, there's a need for repeat procedure. In fact, about half of the patients stop after 2 treatments. I don't think that's because it's not working, but it just may become a nuisance. But it is something that can be done in the office, does not require anesthesia, and nothing goes in your body. So moving to the next category, which was the neuromodulation. So the first one is the office-based option, which is posterior tibial nerve modulation. That's what that acronym stands for. This is a small acupuncture-like needle that goes right above the ankle in the back of the leg. You can see on that top picture, hopefully. And just to sort of explain, because it sounds like, well, why are you putting a needle in my ankle to help my bladder? So what I show in the bottom picture is the nerve that needle is stimulating, which is called the posterior tibial nerve, which is a branch off the sciatic nerve, actually comes in from the same root where the nerves that regulate the bladder, that help the bladder relax and contract. And that's what's showing. It goes all the way up to that S3 level. And that's sort of the science behind why this works. By stimulating that nerve, and this is often done at a weekly initiation. So it's once a week for up to 12 weeks, followed by maintenance. It takes about 30 minutes to do in the office. It's completely painless, and it hopefully regulates the bladder and controls the symptoms. So an advantage here would be, the take home for this is, in the office, none of the risks of Botox, none of the risks of surgery, and hopefully helping, but often needing to come to the office and requiring a maintenance. It's not something that which can sort of permanently fix it. And that leads to the sacral neuromodulation. And I want to focus on this. This is the INTERSTIM device. It's now INTERSTIM 2, similar to what the tibial nerve does. Is this goes directly into the area, that nerve root that controls the bladder. That's the S3 level. It goes in, and it's basically a pacemaker for the bladder. So what you see here on the middle of the right side are the batteries. The top one is the what's called a recharge-free battery. Has a battery life anywhere from 5 to 8 up to 10 years. The bottom one is the micro, which is a rechargeable one, up to a 15-year battery life, but requires frequent recharges, just like a cell phone or any other device. And these regulate the stimulation, which goes to the nerve. And the idea, as I mentioned before, is that if there's a communication breakdown, and by regulating that nerve that helps the brain and the bladder talk to each other, a lot of the symptoms of overactive bladder may be resolved. The nice thing about this is also, before just saying I want this and going into a hospital or having a battery implanted, there's an office-based nerve test, which I think is a great feature and benefit of this option, in that it allows you to determine, will this work? And if it does work, it allows you to say, now I know if I get an implant and I'm able to regulate that nerve, I expect success. So what is this test that I'm referring to? It's an office test. It takes anywhere from 10 to 15 minutes. You come in, no anesthesia, no prep, no stopping of your medications, no fasting. You lay on a table, and on your abdomen, so you're laying sort of flat. We use lidocaine to numb the skin, and a small temporary wire that looks like a hair strand goes in the upper outer buttock area, and we go in to the nerve root, where those nerves from the sacral area that go down to the bladder come out of. We test it to make sure we're in the right area, and you're awake for this and you're participating in that, not feeling any pain. You go home with an external generator, looks like a little cell phone that attaches to it, and you go home. And sometimes I've had patients who, a day or so later, when the rep calls them, they say, Dr. Shapiro, I slept through the night for the first time in years. And it's almost, it's really, for a patient and also for a provider, to get that level of sort of satisfaction to know that you had an immediate and significant and drastic intervention in such a short amount of time is great. The programmer, which is that cell phone I explained, allows you to regulate it. So there are different settings, and if initially you're not getting good outcomes, we have anywhere from about 3 to 7 days where that temporary wire is in place to try to troubleshoot and to try to get you to the point where your symptoms are resolved. Regardless, some people say, I don't want to take it out, but we have to take it out. Usually, again, within a week, it comes out, you get a little Band-Aid, you don't feel anything. And if there is a significant improvement in your symptoms, then we move on to the next step, which is to, under sedation in the hospital as an outpatient, put a permanent wire in that stays in, that has what's called tined leads. So it anchors in there and it doesn't move. And we put one of those batteries in that you choose under the skin. You don't feel anything, nothing's external. Importantly, all of the new generations as of 2020 are now completely MRI compatible for a full body MRI scan, even with the higher power magnets, which is great. So does it work? And the answer is yes, it's safe and effective. So it's can 3 times greater improvement in your quality of life. About 3/4 of people achieve success. What success means is clinical definition of success is a greater than a 50% reduction in your symptoms. So some people, and what our desire is that we can get you to the point where you are completely dry. But if you are someone who goes 5 times at night to the bathroom, or you wear 5 pads a day, and we get you down to 1 or 2 pads a day, even if it's not completely dry, that is a significant improvement in your day-to-day life. And I have here that 84% of people who undergo the procedure have patient satisfaction. And I think that's obviously, important. So is this the right therapy for you? It may be, it may not be. I think it's important to know about it, even if you're not at the place right now where you're ready to obviously commit. But if you are someone who has overactive bladder symptoms, if you've tried to change your diet and reduce fluid intake, if you've tried the medicines and they haven't worked, or you've had some adverse effect to the medications, and they're not giving you the relief you want, then this may be something for you. And again, it's an easy office-based evaluation covered by insurance. Important to mention that. So this is not something that you're going to be paying cash for. This is covered by commercial insurance. It's covered by Medicare, obviously, and Medicaid. So that is sort of my last slide. Here is our office number, and if you want to make an appointment, if you are a current patient of ours and you've thought about this and want to hear more, we'd love to see you. If you are someone who lives in the area and would like to come in to be evaluated, to talk more about it, you're welcome to call. Again, I appreciate your time, and I'm going to open now to questions. So I'm going to go look at the Q&A, and if you have questions, I'd love to answer. There's a question that I'm seeing about the laser procedure, but that's sort of, I can answer that sort of outside the scope, of this, of the talk. That's I assume referring to someone who had a procedure for their prostate. If you want, that Q&A box should be on the top of your screen. And you can type something in if you want. Hopefully everything was self-explanatory. Here's a good question. How long do you have to try medications before you try an advanced therapy? There's no limit. You can be someone who tries a medication for a month and says, usually most medication, let me just say, by a month, you should know if it's working or not. You don't have to wait 6 months. So if you try a medication for a month and you say it's not doing anything, if you try it for a week and 2 days in, you feel that you have dry eyes, dry mouth, or you just don't like taking medications, any sort of intolerance to medication, it's certainly appropriate to go to third line. Oftentimes we want you to go through the steps, even though this is a non-invasive and pretty much risk-free procedure. It is third line, and even though it is covered by insurance, I think it's appropriate to go through the proper steps. Any other questions that are dealing with the INTERSTIM? Someone else asked the side effects of the implant. There really should not be any side effects. Like with any procedure, it's unfair to say something is completely risk-free. So what are the main side effects? You can have obviously an infection or bleeding. This is implanted, with the device is implanted pretty shallow. So you have a depth under the skin where you're not feeling it and you can sit and lay down without being bothered, but it needs to be close enough to the skin that through Bluetooth, we can communicate with it to help program it and help you troubleshoot down the road. So you're not near any big blood vessels, but you can have an infection. You can have an infection from any small procedure. There may be some discomfort, a tingling sensation. Again, where the nerve goes, it shouldn't be stimulating any other nerve, but that would be, if anything, a sensation of having a uncomfortable tingling, or I would say infection and bleeding. And those are really the primary side effects. The side effects of the office nerve test are basically zero. I mean, you can do it on blood thinners. You're not going to have bleeding afterwards, such a small, little wire, and we can just take it out, and doesn't need anything to be done afterwards. Well, again, it looks like that's it. If there are any other questions, I hope they've either been asked or maybe everything was very clear. Again, thanks for joining. Appreciate your time and attention. Look forward to seeing if you have further questions regarding this. And have a good night, everyone.